Great, thanks so much. Interesting timing as we just presented and I participated in a panel presentation to our legislative body at the state, also on long COVID, very similar slides. And there were about five presenters, including a patient. I think really important to get patient perspective on long COVID. So thank you so much for joining, and I'm happy to jump into this topic. And I will answer quite a few questions through the presentation, and then obviously we have time for additional questions. All right, next slide. So what we'll focus on, I think, is important to understand what long COVID is, and the idea that there are multiple names, and the definition varies based on what we call it. So we'll go through that. Also, what do we know about long COVID? This is a new disease entity. COVID has been around for 4 years, and so this disease entity is also new to us, and probably not quite 4 years. So closer to a couple of years. And so we'll talk a little bit about that. I'll touch on who can get long COVID. This is really important. Also, the possible mechanisms, and this is pretty heavy scientifically, so we'll touch on it a little bit. And then there's plenty of additional resources at the end if you're interested. And then the impact of vaccines and treatment on long COVID and the SARS-CoV virus. So, next slide. Great. So let's start with the name. So we call it long COVID, but it's also known as post-COVID conditions, long haul COVID, post-acute COVID-19, long-term effects of COVID, chronic COVID, and post-acute sequela of SARS-CoV-2 infection. So that's a lot of names. And they all, depending on what name you use, it has a different definition. So then let's try to bring this to a manageable definition. And this is the CDC definition. Next slide. Great. So we're gonna focus on long COVID. And this is the CDC definition. It is a patient-created term. So I think it's important to understand that much of the research and our understanding of long COVID is secondary to patients being advocates for themselves and bringing these concerns up to us in the healthcare field and in the public policy arena, public health arena, to make sure we understood that this is not just in their head, right? This is a real entity. So the idea here is that the signs, symptoms, and conditions that continue or develop after the initial infection. So there is an initial infection, and then these develop after, and they're present for 4 or more weeks. So a month out, you still have some of these signs and symptoms. And that's important, is to understand that it continues beyond that acute phase, the first 2 weeks. It may be multisystemic. And what that means is it involves lots of organ systems within the body. So, and we'll get into that. It can present with relapsing and remitting a pattern, or progress or even worsen over time, and can become certainly life-threatening. So that's also important, is that it's not a straight line. It can go up and down in symptoms over months to years. It's not a single condition. And this definition, again, is driven by the CDC and by patients, but it is, as more information becomes available, we will then change the definition to include the progression of the disease, because it is a very new disease. Next slide. Okay, so with that understanding that depending on the type of the name you're using and the definition you're using, what do we know about long COVID? So this again depends on how many, what definition we're using to tell you how many folks have it. But in general, the belief is that approximately 10% of individuals with severe respiratory COVID disease then can become victims essentially, or subjects of long COVID. So they could acquire this infection. When you look at, but that number, just so that you know, that 10% is a general number. Some folks have said it's as small as 3% or as large as 30%. So it is a moving number based on definition. 65 million individuals worldwide is, again, an estimation or an approximation. And the disease can be very mild, or it can be really debilitating and detrimental to folks. And it varies over the course of the years that folks may have it as well. According to the CDC, most people report tiredness, fatigue, post-exertional malaise. So after you're up and out of the house, you're just incredibly tired and it's difficult to do much, and fever. They also, there's a respiratory component, difficulty breathing, cough, chest pain. There's also some what they call the brain fog. So it's a difficulty in thinking. It's a headache, difficulty sleeping, or dizziness. And then there's some GI or gastrointestinal issues, like diarrhea and stomach pain, abdominal pain. When we started to look into into how you could find evidence besides symptoms of COVID, looking at X-rays or certain kinds of radiologic findings, including things like a CT or a CAT scan and an MRI, there were findings in the olfactory bulb, the brain, the heart, and the lungs. And the olfactory bulb, remember, is what we use to smell. And so that's one of the early symptoms, I think, that people said with COVID was the loss of smell, remember? And so this is something that when you look at that with an X-ray, they are seeing that. And then there are other findings, and this one is pretty significant, is these microclots, or really small clots that form throughout the body, and they indicate a hypercoagulable state, which just means you're more likely to have clots within the body than normal, and that can lead to problems. Next slide. So now that we know a little bit about kind of what the long COVID types of concerns are, I think there's other things to understand. Is what has what are the possible mechanisms now that we know that it affects many systems and can come and go. So what they've done is researchers have looked at other what they call post-viral sequelae, or post-viral issues, right? After I've had a viral infection, what are things that can happen to me? And so that's important. And there are two conditions that are also seem to be related to this. One is called chronic fatigue syndrome, and there is belief some relation to long COVID. And the other is myalgic encephalomyelitis, so a lot of muscle concerns. That's another condition that's often related to a post-viral or after virus infection. The specific viruses that they're looking at that offer some potential pathways for COVID. And so what this is saying is that this is not unique to COVID. We see it with other viruses. So one of those is the Epstein-Barr virus, or we call it EBV. Very common. People think about it as giving the mono, so this is a very common virus, and there are post-viral situations. Another is the measles virus, which you can see prolonged issues after even clearing the measles virus. And then the final, and I'll have trouble saying it, so it's sitting there as the final viral infection. And then finally, the other piece to understand is that they've done studies and they've found persistent viral components, so pieces of the virus in tissues in some, but not all patients. So if you look at it later, it could be either the whole virus or parts of the virus are still months later sitting inside some of our organs. So that's something else that is evidence that there's this long viral process that's going on, or after the virus process. Next slide. So who can get long COVID? I think this is an important question, and this is probably part of what we want to understand here. anyone infected with the virus can develop long COVID. So this is the reason that what we're going to push to prevent it is preventing getting COVID to begin with, right? So, and this is the reason that vaccines are very helpful in preventing long COVID. It does tend to occur more often in individuals that have more severe disease. So if you remember back to a couple of 4 years, 3.5, 4 years ago, we had fairly significant COVID infections, and they were really, really difficult on individuals. And so those severe cases requiring hospitalization and ICU stays, more likely to develop, not everyone, but more likely to develop long COVID than a mild case. Though again, anyone can develop long COVID if you've been infected with the virus. The other piece to understand is that each time you're reinfected with the virus, you run a risk of developing long COVID. I myself have been infected 3 times over the course of 2 years. Never a significant case, but each of those times gives the opportunity for long COVID to develop. So really important for us, and I give thanks every day that I don't get it again, right, by my vaccines. So really important to understand that. The folks, again, just to touch on it, at greatest risk are going to be those individuals that had severe disease, hospitalized or in the ICU. Individuals with underlying health conditions also at increased risk, just like they are to have severe COVID if you have an underlying disease. Unvaccinated individuals, again, at most risk, and that is the same for who might develop severe. So you see the progression. I didn't get vaccinated, I had severe disease, I developed long COVID. There is some progression there. Not 100% by any means, just more at risk. And then the big group that we should talk about as well is health inequities over many generations, over many years, are increasing the risk of folks developing long COVID. And it makes sense, right? So if you are an individual who's really dealing with significant inequities in your ability to access healthcare, in your ability to stay home when we ask you to stay home, in your ability to mask, you are at increased risk then for developing COVID and developing long COVID. So this is really a population that we serve in this Commonwealth, and we should spend the time to make sure they understand they're at increased risk and we want to help them. So also the question as to whether or not you have access to primary care. We'll talk about what we do for these patients in a bit, but I think that's going to be a concern as well, is being able to seek the care you need is also something that we know disproportionately affects some of our populations. Next slide. So I thought we'd touch just briefly on the impact of the vaccine and treatment on long COVID. So there's some good news here. I'll start with the pediatric recent study just this month published. It found that vaccinating children against COVID provided about a third or 35% effective in preventing long COVID for up to a year. So we vaccinated them, and a third were protected against long COVID for up to a year. And what's interesting about this is the primary way that they were protected and that we prevented long COVID was because it prevented COVID infection to begin with. So it was clear that the group that didn't get COVID because of the vaccine, then were more likely not to get long COVID, as we've been talking about. So really important reason to vaccinate as well, even in pediatrics. Now, the numbers for long COVID in pediatrics, just so that we're clear, are also less significantly less than in the adult population, because children in general had milder cases of COVID, I would assume, as well. Multiple studies have been done looking at vaccine protection against long COVID in adults, and found to be very effective as well, more effective even than in pediatrics, likely secondary to the fact that adults are, when they get COVID, could potentially have more severe disease. So important to understand. So then we thought, so now we understand our vaccines and how they protect us. Now the next question is, what does Paxlovid do for you? We know it's helpful against severe disease, but is Paxlovid also helpful against developing long COVID? So a recent study looked at, evaluated Paxlovid treatment in non-hospitalized hospitalized individuals to see if it protected them against long COVID. And important here, it didn't make it, it didn't protect them, but it also didn't make them more likely to get long COVID. So this was a little disheartening to think that Paxlovid, by preventing the severe disease, wasn't necessarily making them preventing long COVID. But the important part to understand here is they didn't look at severe cases here, because in general, Paxlovid wasn't given for severe cases, right? I took Paxlovid a couple of times when I had a COVID, and it certainly made me better, and I felt better. I got better quickly, but I wasn't severe. I wasn't going to be in the hospital. So I think that's one of the limitations of this study. More research needs to be done to understand what we can do to protect individuals once you've contracted COVID. Next slide. So how do you protect yourself then? And how do we protect our communities? So easy, avoid the infection to begin with. So if it was just that simple, right? I did my best to avoid it for 3 years and I got it 3 times. So do your best, but get vaccinated. So if if we can't avoid getting infected, we want to avoid getting reinfected, and we want that infection to be as mild as possible. Right? So avoid reinfections, avoid primary infection, and then again, stay up to date with all of our vaccines. Right now, up to date means the 23-24 vaccine. Next year, it may mean the 24-25 vaccine. So this is going to be very important for us. And remember that COVID, unlike flu and RSV, what we talked about last time, and many other viral infections during the winter, COVID is not seasonal. COVID currently can happen year-round. And so for that reason, if you've not been vaccinated yet, or you have community members, get them vaccinated as quickly as possible with the 23-24 vaccine. That will be very helpful. Some other basic infection prevention strategies are it's just good, it's a good way to think about managing yourself during the winter. And that includes things like staying home when you're sick. So, not only are you protecting others from potentially your COVID infection, if that's what you have, but even other viral infections. And it's also protecting yourself, because if you're sick from something else and you get exposed to COVID, your immune system is less likely to be able to help protect you. So again, another reason, stay home when sick, to protect yourselves and to protect others. Wash your hands, right? We want to make sure we're washing our hands, using hand sanitizer, and cleaning surfaces. We mentioned a couple of weeks ago that there are some viruses that stick on those surfaces, and they're hardy suckers, right? And they will stay around for a while. So let's clean our surfaces when we know there's the possibility of infection. Avoid close contact with somebody who has COVID-19. We've stressed this for quite some time now, but it is important to say that if you know someone with COVID, have them use their own bathroom if possible, stay in their own room if possible, and avoid close contact with them during that week to 10-day period. Masking when the COVID activity is high in the community, and that still includes today. So if that's something that you're worried about, certainly feel comfortable wearing a mask. We do in hospital settings, when we're in many hospital settings as well. And then test and treat when appropriate. And I think again, we want to make sure that if you have COVID, that you and you are susceptible for a significant infection because of medical conditions like mine, then you're able to get treatment and prevent that severe illness. And so that's going to be really important as well. Next slide. So this is an important slide because it's got lots of information that will be available for us to send out, and we're going to be putting it on our website very soon. That gives us some opportunities for our to help community members know where to go to if they have questions and if they're looking for care. So there are multiple centers that are studying this. The Recover project study is very important, and you can join if you have long COVID and get care, and they'll study study you as well, and that's really important. And you're providing us more information to know how to help you and help future long COVID sufferers. In addition to that, there's plenty of additional information here that the CDC offers, tips. This one is really helpful. Healthcare provider appointments for post-COVID is really important. And then preparing to discuss your post-COVID conditions with a healthcare provider. Because remember, this is new. Healthcare providers now are very knowledgeable, but this goes beyond oftentimes what our primary care folks are comfortable and willing to necessarily treat and support. So it's important to make sure that you know what you need and you have a way to discuss it, and then they can help refer you to experts, which are, again, all over the Commonwealth to help treat the long COVID they call them long COVID clinics. Next slide. All right, so thank you very much. Not a long presentation, but I hope to answer any questions that you have additionally.